And Debbie, before we dig into the specific thing that I wanted to talk about, which is the poultry industry, because this was the substance in many ways of the alert that you've been sending out and the urging that you're trying to get OSHA to actually act to protect people, I wanted to give my audience a couple of real senses of what's going on out there among workers. And I've done a ton of segments since the pandemic started individually about frontline workers, various types of workers over the course of, yes, the last 3 months. But I think giving people a big picture will, I think, underscore the enormity of the crisis we're facing. And so I want to read a couple of statistics that you sent out in your alert and some of the things you footnoted. We know about the frontline workers in the healthcare industry that 60,000 of them have now been confirmed with COVID-19 and hundreds have died. And those are the people that every day people stand out on their porches or wherever they are on their lawns and ring bells for. And those are great people. Let's not underestimate that. But on top of that, you've got lots of frontline workers, which I think often get a little bit obscured by the healthcare workers. And I don't say that in a negative way. I just think we are so grateful to those people who are taking care of people in hospitals. But you've got, for example, the frontline workers that feed us in meatpacking and food processing plants. And you footnoted some data from the Food and Environment Reporting Network that at least 37,000 plus workers, that's in meatpacking, food processing, and farm workers, have tested positive for COVID-19, and at least 127 of them have died. And I want to underscore that every time we say at least, and you'll talk about this as well, sometimes we just don't know.
Right.
And especially for low wage workers and people of color, low wage workers of color who end up basically going home and they're often not tracked. They may die of COVID-19, but they're not part of the statistic. And then you've got 100 or so transit workers who have died taking people, moving people from place to place, especially in New York City. You've got the harvest coming where you've got thousands of farm workers, the summer harvest, flooding into places like Florida and Oregon. They're going to be exposed to COVID-19. So the first overall question I want to ask you is this. In your experience, and you've been at this for so many years, have you ever seen the scale of workplace illness and death in such a short period of time, really because of one factor?
No, this is an unprecedented emergency, which just further sort of underscores the total failure of this administration to step up and, uh, enforce the OSHA law and protect workers. Usually in the meatpacking industry, I don't know, maybe you have a dozen workers get killed a year, maybe a little bit more. You've had over 100 that we know of have died from COVID-19. Um, the meat, I think you could say about 20% of plants, 50% of other plants um, are getting COVID-19 in meat and poultry, which is on top of the normal regular injuries and illnesses they get in terms of amputations and cuts. So this is just unprecedented in the scope and the way it's affecting not just meat and poultry and of course healthcare, as you said, but bus drivers and occupations that normally you don't think of as so hazardous, and grocery store workers and warehouse workers and um, all the workers that have been working so far. And now, we're getting a lot of letters, a lot of emails from restaurant workers who are terrified about indoor dining and having to work in a workplace where nobody's wearing a mask but them.
And you, I assume, your daily life now, every single hour, you are literally trying to save workers' lives and make sure they don't get sick. And you must be really deeply concerned about this recent surge now that we're seeing sweeping across the nation. I just saw this morning Dr. Anthony Fauci predict that we may have, if we don't start acting in a more responsible way, and I don't mean just individually, but as a government handling this, we may have 100,000 cases per day, which of course, a huge percentage of those, to your point about restaurants and bars, a huge percentage of those cases are happening in the workplace.
Right. It's really, I don't know what else to say, but it's reckless, it's irresponsible to not think about what it means for the individual workers who work there, as well as the customers, and to sort of reopen, because the key to a healthy economy is to beat COVID 19, not to open and sicken 100,000, people uh, immediately. And I think, what's really stunning for me and striking, and maybe, call me naive, but at the beginning of the pandemic, like in the middle of March, when I would get calls from nurses or meatpacking workers that it's spreading, and I would say, just call OSHA. OSHA's
Yeah.
going to come out immediately. They don't have a standard yet, but they're going to cite the company because we know it's 6 feet apart, it's masks, it's the proper equipment in healthcare, it's triaging patients. And OSHA just simply, when they called, said, we're not doing inspections. We're not sure it's our jurisdiction, one of OSHA inspectors said, and wrongly, but um, there's nothing we can do. And that came right from the top. That came right from the president. It came from Eugene Scalia. That is what they were told to do. And they completely failed. And so now it's really up to the state governors, and some are doing it right, and some seem to just have politics guiding them.
And I want to underscore for people when Debbie mentioned Eugene Scalia, that name should ring a bell. He is the son of the departed Supreme Court Justice Anthony Scalia. So one understands where they come from, at least on the political wing and the ideology of how to address and take care of workers. And so on OSHA, before we talk about the poultry industry, which to me is shocking what's going on there, I want to ask you one question about whether you can separate or take into account the fact that you and I have talked about OSHA for a very long time over the last several years. Is it the fact that OSHA has always been really rickety and not staffed enough from what it really needs to be? Or is there a level of outrageous behavior that's happened now under this administration that takes it to a new level? Or is it really the actual fundamental, really understaffing of OSHA that's been true for really decades?
This is a level of outrage that's never existed before, that even with depleted resources, OSHA can do more. In 2009, when Obama became president, and Jordan Barrett became Deputy Assistant Secretary, and I became the Chief of Staff, we were notified that there were a lot of construction deaths in Texas. And then OSHA was pretty understaffed, after sort of 8 years of the Bush administration, and we just took inspectors from all over the country and sent them into Texas to do a sweep of the state, to send a very clear message that OSHA was on the beat, that they're here, and that employers have to provide a safe workplace. OSHA has never in its history not gone after bad actor industries. Ronald Reagan and George Bush gave out the first George Bush, some of the highest fines against meatpacking companies. I mean, the fact that the entire healthcare industry, the entire nursing home industry was given a pass, not to have to protect workers and provide safe conditions. And on top of that, you're right, though, Jonathan, and that is that the Trump administration is really trying to, get OSHA to disappear. And so it now has the least number of inspectors it has in the history of the agency.
Okay, so now let's go to the topic that we wanted to focus on. And I know your time is short, so I wanted to dig right into it. Some weeks ago, I had on the show Stuart Applebaum, who you know quite well, the president of the Retail, Wholesale, and Department Store Union. And he was talking about the absolute fear and panic and crisis that was going on in the poultry plants of workers that the union represents in the South, particularly. And it was just astounding what was happening to folks. And of course, you know as well as I know that part of the problem in a poultry plant is that, first of all, the speed of the line is quite fast. And also, people talk about social distancing. People actually, when we use the metaphor, working shoulder to shoulder, they literally are shoulder to shoulder. And yet, what the Trumpsters want to do is actually make it worse now. So explain what's going on, which to me was, I guess, like you, maybe I'm naive, but it really blew my mind. It was so unfathomable.
Before I even begin, I just want to say that this really highlights the incredible health disparity that's going on with COVID 19, what's happening in the poultry industry. And that is Black and brown workers are in many industries, they are disproportionately represented in many of the frontline industries. Um, from nursing home workers to meatpacking and poultry workers, and they're bearing the brunt of COVID-19. And as we know, not only do they are they out there with greater exposures because they're the essential workers, but also when they get COVID-19, they have more serious complications. And that's why poultry and meatpacking workers are terrified. And uh, the industry really just ignored the CDC guidance for a very long time. And only after the union really, and I have to give Stuart Alabama, the head of RWDSU, and the UFCW, the parent union, a lot of credit for coming out with press releases and saying workers are dying, workers are getting sick, and nothing's being done. And once those press releases came out, the media started covering it, and it really was the kids of meatpacking workers, because workers are so scared
Hmm.
to say anything. It's just like a climate of fear that they live in, even in the union plants. Um, to raise these issues in the media and the industry. I mean, we all knew by then, by like the second week of March, we all knew about 6 feet apart, right? And a week later, we were told masks so that we, if we're infected, wouldn't spread it to other people, and stepped up, being able to wash your hands repeatedly. And meatpacking plants continued to keep workers shoulder to shoulder on the line for 8 or 10 hours a day, incentivize sick workers to come to work because you didn't get your bonus
Hmm.
unless you worked every single day during the month of April. And if you were sick from COVID, you didn't get your bonus. So it incentivized them to come to work when we know once you're sick, you really need to quarantine. But they wanted people to come to work sick because they're interested in their bottom line and their profits. And the meat industry is actually making money now with so many workers. I think it's 30,000, as you said, meat and poultry workers sick. And that's an underestimate because some states aren't reporting any data by industry,
Hmm.
like Nebraska. So the cases are much more. And we know of about 100, 120 that have died so far. And you know what, Jonathan? Meat workers are still working shoulder to shoulder. The companies put these plastic barriers between them. Like that has some magic potential to protect them, but there's no evidence, not it doesn't work at all. That you have to separate workers 6 feet apart and then put the plastic barriers. You can't have workers working shoulder to shoulder and having plastic barriers on the side, but there are thousands of workers in these plants. And also, we worry that it's going to impede ventilation, which is really important in getting the virus out of the workplace. And, the meat industry is spending a lot of money. The poultry industry, Tyson, JBS, Pilgrim's Pride, Purdue, Smithfield, National Beef, Cargill, they're spending a lot of money on public relations and saying they're doing everything they can. And, I hope consumers are not fooled. They can do a lot more. They can really protect workers. And instead, they apply to increase their line speeds and keep workers working closer together so they can produce more and increase profits. And some of the things that was sort of stunning to me to find out about the meat and poultry industry. I know there was one pork plant in Waterloo, Iowa, where 1,000 of 2,800 workers were sick and many workers died, and they overwhelmed the hospital system there. And most of that pork, if not all of it, went to China.
Hmm.
So it wasn't about feeding America. It was really just about company profits. And I don't really understand this administration is the first ever since the creation of OSHA that has not gone after a bad actor industry. And instead, OSHA and the president and the secretary of labor are aiding and abetting uh, these unsafe practices that are sickening tens of thousands and are killing meatpacking workers.
Well, I'm shocked, shocked, shocked that these companies would choose profits over the lives and the safety of workers. That's never happened in history, right? As you can tell from my dripping sarcasm. But and I want to just zero on this one thing. Tell us about the waivers that these poultry companies are getting to increase the line speed at this point.
So under the Obama administration, they issued a new rule on how poultry would be inspected. And at that point, the meat industry, even USDA, which is a government agency that is the meat industry, It's very few industries have their own representative in the government, but that is the meat industry. And they wanted to be able to increase their line speeds because they would make more money and more profit. And the Obama administration said, no, it's not safe for consumers and it's not safe for workers. But under the Trump administration, they decided that they would allow companies to waive the requirements of the rule that was passed in 2014 and increase their line speeds, which means that workers would have to work harder and faster to produce more chickens to increase the company's profits. And 15 waivers were issued in the middle of the pandemic
This is
to
amazing.
Tyson, to Mount Air, to George's, and I'm forgetting the fourth company, all of which had poor safety records. They either had COVID-19 outbreaks or they had records of amputations in the plant or OSHA violations. But for the companies to want to increase line speeds and the government to increase production, what's in fact, CDC said one of the things that they should do is slow the lines down to spread workers farther apart.
Exactly.
So instead of having, you know, like 10 workers on a line, now you're going to have six. I mean, most lines have hundreds and hundreds. So you just would have less workers and maybe add another shift. But that way, workers can separate 6 feet apart and build new break rooms outside. You know, they're all crowded into break rooms and locker rooms. I mean, the industry really has to retool. And these are billion-dollar companies. These are not small and mom and pop shops that are going to that need government help to do this. It is their responsibility to protect workers, but they have a very good PR effort. And consumers, in the end, consumers, it's really up to you all about check where your chicken's coming from and decide whether you really want to support these companies.
That's a great ending, and really thank you for, first of all, for your work. You're really one of the most important advocates for workers' safety and health out there, and especially now, but always. And thank you for being on the show as usual.
Thank you, Jonathan, for having me.